educational for pain management. Today I'm out at the Carefree, Arizona Recreational Park, which is gorgeous. There is a slight fee to get in, but once you do, there's a plethora of hiking trails, picnic areas like we're at here, and there's just not that many people here. So it's gorgeous. The topic are the 5 components of responsible opioid medication management. Now, what's the big deal about narcotics? Why is Congress getting involved and states enacting harsher regulations for narcotic prescriptions? Because it is a big deal. Between 2000 and 2010, narcotic prescriptions in the U.S. quadrupled, and the amount of deaths from overdose fatalities have gotten in excess of somewhere between 15 and 25,000 per year, which is amazing. Now, a recent article in the LA Times looked at that number and also looked at how many people end up in an emergency room with an overdose but not a fatality. The answer is 30 times the amount of overdose fatalities. So it's about 500,000 people every year end up in an ER from a narcotic prescription overdose. So how are pain clinics supposed to do opioid or narcotic prescriptions the right way? Well, here's the 5 ways. The first method is a narcotic agreement, and some people call it a pain contract, opioid contract, whatever the terminology. Essentially what it is an agreement between the pain doctor and the patient of how the relationship is going to work. And a lot of it is a sort of an implicit kind of thing, that if you didn't have the agreement that it would still be understood. But this puts it in overt terms of what the patient is supposed to own up to, so to speak. One is pretty ubiquitous. The pain doctor will be the only person prescribing the narcotic medication for the patient. In other words, the patient won't go around doctor shopping, getting medication from multiple different doctors, because either they want to sell them or they just want to take more. This states that they won't do that. The second one is pretty much usually that they'll admit to urine drug screening or blood testing or hair testing, whatever the method is, to make sure that the patient is being compliant with his or her treatment regimen. And then there are others. Some pain doctors will make sure that the patient is able to come in same day to have a pill count and drug testing. There might be a multitude of things. And usually it states that if the patient violates the agreement, then they are allowed to be dismissed from the practice. They agree to that up front. Because if you think about it, it's a very big deal for a pain doctor to take a person on as a patient. There's a lot of liability involved. There's a lot of trust involved between the patient and the physician. And there's an onus now on the physician to make sure that they're treating the patient properly, because there's a trust factor. A lot of pain problems are not able to be diagnosed on an MRI or an objective test, like headaches, for instance. The physician wants to help. They want to believe that the patient is having the headaches. But there are folks out there who aren't having headaches, but they say they are to get the medication. So the agreement helps. Another one, the second one, is urine drug screening. Now, what happens is when a patient comes in, either routinely or randomly, the pain doctor will do a urine drug test. And this can tell the pain doctor if they're taking the medication that was prescribed, if they're taking it in the appropriate amounts, and also rule out illicit drugs. If you're taking Vicodin regularly, the pain doctor doesn't want the person taking heroin or cocaine, because that can lead to a fatal overdose. Also, it's not very good for the person. It can be fatal for your heart as well. So that's urine drug screening. A lot of people get upset when they get drug tested, but if you look at the facts, the research shows that about 25 to 35% of patients divert their medications. They sell them, trade them, barter them, whatever, and it's people you wouldn't even think. Retired individuals who want to supplement their Social Security income by selling the medication. It's amazing what's happening out there. So it really is a nice safeguard to have, and you shouldn't feel singled out if you're being drug tested. It just puts everybody on a level playing field, and it further enhances the trust between the doctor and the patient. okay? Number 3 is the state pharmacy monitoring database. Not every state has it. About over half, I think 60–65% of the states have one now. It's pretty pricey for them to implement that, so some haven't been able to do it. Florida now has it. They didn't before because of funding issues. Arizona has one, and it really helps because it can show if a person is getting prescriptions from multiple doctors, okay? So that can help, and especially can help with new patients to make sure that the person is not already getting narcotic medications and they're just trying to supplement that with another doctor. Number 4 in the responsible opioid medication management is for a pain practice to be multidisciplinary, or what we call comprehensive. The Institute of Medicine came out with a report last year, 2011, talking about what the optimal modern pain management practice should incorporate. And the answer was a realm of treatments. It might be medication management plus interventional pain treatments, maybe some physical therapy, chiropractic treatment, acupuncture. The more options that are available to patients, the better the chances of them getting pain reduced or eliminated, and the less need potentially for narcotics to be more and more needed. So that's the modern pain management that is been recommended and makes for a very responsible clinic when they do that. Number 5 is the quality of the doctors who are working at the clinic. If it's board certified, fellowship trained, you know that you're dealing with doctors who just simply know what they're doing. They're especially trained in medication management along with other treatments, and you know there's no foolproof with medication management, but they're up on the latest treatments available and are as responsible as absolutely possible. They want to help patients, but they also don't want to, end up with these overdose situations. There you have the 5 methods of responsible opioid management, and it just so happens Arizona Pain Specialist does them all. They have board-certified, fellowship-trained, and award-winning doctors at each location. They've won the Patient's Choice Award 5 years in a row now, and as they've grown larger, the quality of care, the staff, they've just grown right along with that growth. So they take most insurances, they do medication management, interventional procedures, chiropractic, physical rehab, spinal decompression therapy, acupuncture, the whole gamut at each location, okay? So call 602-507-6550 today for more information and scheduling. I'm Dr. David Greene with PreferredPainCenter.com.